We're joined now by Dr. Michael LeFeVre from MU Healthcare. And Doctor, thank you so much for being with us this morning.
Good morning. It's my pleasure.
Good morning. And now, how is MU Healthcare changing its protocols in those primary care clinics during COVID-19?
I'm sorry, I lost your voice.
Oh, I'll ask that again. I'm so sorry about that. How is MU Healthcare changing its protocols for those primary care clinics during this time?
Well, it's important to understand that the health and safety of our patients, our staff, and our providers are, in fact, our highest priority. We also understand that this COVID issue sits on top of all of the healthcare issues that we were dealing with before, and those don't go away just because we happen to have this virus causing all this trouble. So it's our obligation to take care of patients in potentially new and innovative ways to make sure that they're getting the care that they need.
So what are you telling patients who are maybe too afraid right now to come to clinicals for physicals, appointments, or screenings?
Well, probably the most important two things are, one, we have alternatives, and specifically we have a video visit alternative, something that we really didn't have available as recently as a couple of months ago. But already the majority of our visits are being done by video. We use the Zoom platform. We're taking care of people in their homes so that they can be safe and get the health care that they need. The second thing is we're keeping clinics safe so that people who need to be seen in person can feel comforted that we're doing that in a very safe environment.
And how do those video visits work? I know there's been a big push right now for telemedicine, making sure that people who don't need to be in clinics and hospitals right now really don't have to go inside.
We're using the Zoom platform, which is being used by the public schools, for example, here in Columbia, and many, many other situations are using Zoom. It's really pretty simple. The patient only has to have a smartphone, tablet, or a computer. They download Zoom onto their phone. We call them up, send them a number, and we're on screen and on audio as well. So it's a face-to-face visit. They just happen to be at home, and we're in the office.
Is there certain types of appointments that those video conferences can cover, or is it really just a wide range?
Well, certainly the physical exam can be an essential part of evaluation for some types of problems. And when that's the case, we have to invite people in, and that's part of the reason we have to keep clinics safe so that we can take good care of those people in spite of having to bring them in. An example would be abdominal pain. If somebody is hurting, we're going to have to touch them to try to figure out what that is. But the majority of patient visits actually can be accommodated by video, and so we can do that and continue to provide the health care that they need.
Dr. LeFeVre, thank you so much for joining us. We'll check back in with you coming up in just a couple of minutes. We do appreciate your time. And local hospitals are dealing with a lot of changes as they try to combat this pandemic. We're joined now live by Dr. Michael LeFeVre from MU Healthcare. And Doctor, thank you so much for being on with us this morning.
Absolutely, my pleasure.
And I wanted to circle back. We were talking a lot about telemedicine and telehealth, essentially. So those primary care doctors can kind of all of a sudden offer these video services. Why is that they can offer them now, but maybe we didn't see as much of a push for them in the past?
Well, the telemedicine that we're providing right now through video visits was not possible under the regulatory environment just a couple of months ago. So in response to the pandemic, the federal regulatory environment loosened their regulations and allowed us to provide this type of care. We're excited. We've been wanting to do this for quite some time, and quite honestly expect to be able to continue to do it in the future.
Okay, yeah, I was going to ask, do you see this kind of impacting the way doctors are seeing patients after this pandemic subsides?
Yeah, I like to say that they're not going to put this genie back in the bottle, and I think that both providers and patients are going to become accustomed to this type of service, and quite honestly, it's both effective and cost-effective and convenient, and I think that we're going to be continuing to incorporate this type of care into practice into the future.
And are these video visits something that's covered by insurance for people, maybe watching this wondering?
Yes, video visits are covered by insurance, and that's another one of the changes that has been made. They relaxed those requirements as well so that we can do it in a cost-effective manner.
And what do you have to say for patients who may be putting off some appointments over fears related to COVID-19?
My advice is don't let the pandemic keep you from getting necessary health care. Your health is our priority, and we're making every effort to be able to provide that care on an ongoing basis in spite of what's going on around us. And it's safe, and it can be done effectively.
And so how does someone know when it's okay that they can maybe put off a screening or an appointment?
Well, there certainly are some services which can be put off safely for 2 to 3 months, and certainly some screenings fall into that category. If you feel well and you have no ongoing health concerns, and for example, just need a pap smear, I think it's fine to put off that pap smear for 2 or 3 months. Similarly, we're not doing screening mammography right now or screening colonoscopy for colon cancer. So there are certainly some things that we're delaying, but probably not for more than 2 to 3 months.
Okay. And now switching gears a little bit, do you feel that MU Healthcare is prepared for a potential surge of patients because of COVID-19?
I'm sorry, I missed that question, but MU Healthcare is certainly prepared to continue to provide the care that people need.
Okay, so I know we kind of have been hearing from national numbers that there is a potential peak coming for Missouri later on this month, I think in exactly 13 days. Is that what MU Healthcare is seeing as well?
Well, MU Healthcare is absolutely prepared to deal with any type of surge in cases in central Missouri. And we're watching the same numbers that you are, and hopefully we will peak out here in the next couple of weeks and things will get better. And if things don't get any worse than they are now, we can be grateful that we live in central Missouri.
Absolutely. All right, Doctor, thank you so much for being with us this morning. We do appreciate your time. I know it is very busy right now.
It's been my pleasure.